two most important takeaways from this guideline really are all of it helps you to be prepared to participate in a construction project and understanding the relationship of HVAC functionality with air quality in the OR, which we all know is so important.
Erin, can you talk a little bit about the recommendations that are new or different?
Yes, we added a new section that is all about the planning phase of new construction and renovation projects. There is increased emphasis on safety risk assessments, including patient handling and mobility, fall prevention, medication safety, security risks, and ICRA, or infection control risk assessment. There's a handy new table that delineates the recommended minimum space requirements for all different areas in the perioperative space. And for future focused design, there's a section on renovation and new technology.
So how will these changes affect how perioperative nurses work?
So perioperative nurses who are facing a construction project might be a little intimidated. They might not know what to expect out of that construction or renovation project. So having this guideline really arms them with the knowledge about what requirements and recommendations there are for the physical space. And no one knows better how to provide input into construction projects than perioperative nurses. So knowing how to participate in planning construction projects by offering clinical expertise to inform the functional program that really provides the basis for the construction plan really is imperative because, as I said, no one knows better than a perioperative nurse how a facility should be laid out and which spaces should be near other spaces.